Eat well, yes, eat more. More of veggies, fruits, go nuts on nuts. Eat less, yes, eat less. Less of carb, fat, and say no to soda pops. Eat well, yes, eat more. More of veggies, fruits, go nuts on nuts. Eat less, yes, eat less. Less of carb, fat, say no to soda pop. Say no to soda pops. Exercise well. Walk, jog, run, bike. Treadmill, elliptical, till soaked in sweat. Exercise more, 5 times a week. Half hour or more, till soaked in sweat. Exercise well. Walk, jog, run, bike. Treadmill, elliptical, till soaked in sweat. Exercise more, 5 times a week. Half hour or more, till soaked in sweat. This is the part 2 of We Choose Health from Public Health, Champaign-Urbana Public Health District. And I'd like to introduce again our panel. Julie Pride, the Public Health Administrator.
Hi.
And we have Dr. Awais Wade. His expertise is epidemiologist, but he is also Director of Planning and Research. And we have Nikki Hillier, Program Coordinator, Division of Wellness and Health Promotion. And the last part we covered in part 1 is what are the consequences of doing nothing. And we covered some aspect. And who are the partners involved in this initiative? And now I would like to ask the panel, what are some of the specific strategies adopted to succeed?
Okay, well, I can start with, I can give you a real brief overview, and I think Nikki will give you more of the details.
Yes.
We chose 3 different areas to focus on. Work site wellness, because most adults spend their time at their jobs, more time at their jobs. Coordinated approach to school health, which is, we do that because most kids spend most of their days in school, just like we spend at work.
Do you catch them?
Well, catch is going to be one of the programs, yes. And then we also have trying to get more smoke-free facilities. We have internal smoke-free facilities now. We're trying to get expanded smoke-free spaces. And Champaign-Urbana Public Health District, as of November 1st, our entire 7-acre campus will be smoke-free. So that means that when you walk into the public health building, you will no longer have to walk through a gauntlet of smoke. If people are standing out there 15 feet from the door, you still have to breathe that in on your way in.
Yes.
And we also hope it'll cut down on some of the toxic trash, the cigarette butts and the wrappers and things like that.
Yes.
So.
And we're not, that kind of feeds into our employee wellness piece. So we're not just, letting staff know and letting our clients know that our campus is smoke-free. We're also offering them opportunities to quit smoking. So the smoke-free campus is part of the smoke-free initiative, but also part of our worksite wellness. With the smoke-free campuses, we're working with the University of Illinois, and we're working with Parkland College, and we're also doing a survey with local multi-unit housing owners and managers to see what they know about smoke-free multi-unit housing.
What is your impression is in the university, the young students and the Parkland, is that a problem, smoking?
Well, all the buildings are smoke-free. Smoke-free Illinois has mandated that, but there's areas where people cluster, and you know, that can be hazardous to people's health also. And it also encourages people to quit smoking. You know, once that, you know, if they have to travel to be able to have that cigarette, like on our campus, it's a 10-minute walk. You know, 5-minute walk, say, for them to have a cigarette kind of hinders their productivity. So they may either, you know, look for strategies to cut down so they can get through the day, or make attempts to quit.
And we will be helping with that too. And Nikki has the smoking cessation programs that we can help with, patches if they need patches, or, you know, there's of course the Illinois Tobacco Quit line. And so, you know, we're offering things to help people stop smoking.
Is this patches affordable?
They are affordable, but they can also get them for free from the Illinois Tobacco Quit line and from our agency.
It's free? But they need to follow a program.
Right, there's a screening process, and then they have to do phone counseling or in-person counseling. So we offer a lot of resources for people that are ready to quit smoking to our staff and to the community. But the staff, and a really good thing about that, and that's really transforming the way that our staff look at their workplace, 2 of them have already quit smoking just with this cue, you know. So we're giving the staff a lot of cues to enact healthier behaviors. So one of the things that we're doing is our smoke-free campus. Something else that we're doing is not only getting rid of our sugar-sweetened beverage machines and vending machines, but we've also offered healthy alternatives. We have a space in our at our agency that's just all about wellness. The room is a place for people to relax, to exercise, to eat healthy foods, and we have a space that has healthy foods at cost. And so one cue is just that the foods are there. The other part is that we're offering them at cost, so they're a lot less expensive than the junk that they were buying in the vending machine. So they have access to water, vegetable juices. We have our little cuties here that we brought in, so they have access to fresh fruits, vegetables.
Can you explain that?
So we just sort of drew faces on the they're cutie lanterns, I guess you call them.
They're just little tangerines, little cuties, or the kind, and it's just a little piece of celery, and it's just a cutie, and you just peel it, tangerine, and eat it.
So that's what people have at their desks instead of candy that they're offering to people. We have, so that space is stocked and has completely taken off. We just operated under kind of an honor system. We have a little piggy bank in there that people can use, and so that's really cutting down just on the foods that people access when they need that fuel or they need that energy throughout the day.
And it's something any place can do. I mean, you do not need a big space for that. I mean, the space we have is bigger than most places, I would imagine, and we're going to have more things in there. But the fact of the matter is, you can take a closet in your agency or somebody's desk and make the honor system. People have been just responding amazingly well to this, and purchasing all kinds of, you know, healthy beverages and water rather than purchasing, you know, the soda, things like that. And I'm really honestly surprised at how well it took off. It just really took off, and that's before the vending machines have even been removed.
So people, they have options, but they're opting for the healthy option. Why? We've set up the queue. It's a nice place to be, and it's more affordable. It's easily accessible. So it's a really good opportunity and effort on our part.
These options are available, affordable, and attainable?
They're really accessible. It's in a central
location. That's the word I was looking for.
But it's in a centralized location in our health department that, you know, all the staff can access. And you can purchase an apple for $0.25. You can go back, purchase an apple for $0.25. You can purchase cheese sticks, pistachios, oranges, things like that. Even little single-serve vegetable trays that have carrots, celery, sugar snap peas, and just yogurt parfaits, all this type of stuff. And it's just a regular refrigerator, and basically ready served food. So they grab the apple, they wash their own apple, and they
take it back to their desks.
Yes, and I like to mention to the public that CU PhD is accessible by bus. Other day I took the bus to CU PhD. I enjoyed it.
Good.
You know, I don't have to drive, and so it is very accessible.
And, you know, active transportation is something else that we have policies set in place so that staff are encouraged to
Yes.
engage in active transportation. One of the things that we ask staff to do is anytime
Yes.
they have to travel, they do so in the least expensive way. And a lot of times that means taking a zip car. So zip cars are at less than a mile away from where we work
Yes.
downtown, and people can walk there. We're hoping to set up a system where they can rent bikes from our agency, you know, staff, and if they have to bike somewhere, they can grab a helmet, grab a bike, and get to where they need to go. Even if they had to drive into
Yes.
town to get
Yes.
to work, they can still have meetings and use that active transportation to get around. Because a lot of staff spend a lot of time traveling in their vehicles.
And one of the things that we did in another division that is not normally associated, you know, with the health and wellness type of things, in environmental health. For the last few years, we have hired in the summer college students who go out and instead of driving around putting larvicidal pellets in the storm sewers and checking for mosquitoes,
Yes.
they actually ride bikes. So they spend the entire summer out there riding bikes and doing their work,
Yes.
and they really enjoy it.
Excellent.
And they're very nice bikes.
They're very nice bikes, and we would like to have something at Public Health where, you know, we have
Yes.
these type of bikes available that
Yes.
people can take and ride to their meeting across town. Francis Nelson's not that far from
No.
us. That's certainly a nice little bike ride. And there's a lot of
Library.
downtown, the library, there's a lot of places that
Yes.
are close.
So when we choose health, we choose these different opportunities that are available, and it's awesome that it's available
Yeah, and
right under your nose.
And that's, I think, what this program is doing, is putting the options out there
Yes.
that are easy, and, you know, it's making the choices easy. If I had to bring an apple in from home, I probably wouldn't. Well, I think my years of experience will tell you that I don't. You know, they might be on my counter. I don't bother to pick it up, bring it to work. If I know that in the afternoon I can hop up, go to the back,
Yes.
and grab an apple for a quarter or something for 50 cents or whatever, I'm going to do that. And it just makes you think about it. You're making conscious decisions, and plus we have a very large building,
Yes.
so you're doing a lot of walking to get back there,
Yes.
and it's just it's a really good, I think it's a really good thing.
One of the things that was sort of staff-driven was we started an employee wellness
Yes.
newsletter that we would put out every other week. And one of the things that one of the writers or the members of the wellness committee recognized was that there is a tool called MyFitnessPal. And so she wrote a little article about it, and, you know, all 120 employees read the article, I'm sure. But, you know, a lot of people read it, started talking about it, started using it, and that's really created this, you know, water cooler type, you know,
Yes.
discussion about, oh, MyFitnessPal, you use it, I use it for this, I use it for that. And what it is it's an online tool, or you can use it as an app on your phone.
Yes.
And it tells you any food item that you've eaten. It can tell you how many, you know, calories and the
Yes.
nutritional value in it. But then also any physical activity that you engage in, you document that, and it can tell you where the imbalance is, you know, how much more you can eat. So what we kind of did from there, so everybody's using this MyFitnessPal and everybody's talking about it from the newsletter, is we got these Fitbits
Yes.
that actually link into MyFitnessPal. So anybody that's using it, it can actually document your physical activity
Yes,
instead
yes.
of you having to type it
Yes.
in. It feeds right into it. And we have these for staff to check out and borrow, kind of like a
Yes.
library item. So that's something that sort of came from the staff and that we were able to enhance and support.
Yes, Dr. Weiss.
No, I know we've talked a lot about the smoking initiative
Yes.
and the employee wellness, but I think Nikki can talk a little bit more about the coordinated school health approach also.
Yes.
So we've been implementing a coordinated approach to child health in
Yes.
several schools since maybe 2006.
Yes.
We work with Carrie Busey, Unity West, Thomas Borough, Fisher Grade School, Dr. Howard, and just this year, Booker T. Washington. So what we really want to do is, instead of this sort of piecemeal effort of a coordinated approach, to really have the school districts implement the approach in a coordinated way, so that it's not just this school or that school, but maybe we phase it in and do a couple schools one year, a couple schools the next year, but all the schools are doing the same thing.
Yes.
We talked about last time the
Yes.
go slow and whoa, so that language piece, but it's also about creating environments that support kids, staff, families in making good, healthy decisions. That we just all the things that we're doing for employee wellness, the things that we can do for child wellness, we need to make it really easy for kids to make healthy choices.
Yes.
And having cupcakes for snacks is not making it easy for them to make good choices.
And we talked about partners that we have in this effort.
Yes.
Two of our key partners in this coordinated school health is going to be the Orpheum Children's Museum, that is going to be taking their educational bus to each of the schools and have educational exhibits. So
where?
At each of the schools.
It's mobile.
It's
They're
mobile.
creating a mobile.
Right. So instead of the schools having to create an exhibit themselves and maintaining it, the Orpheum, which already has a history of doing a lot of children education, can build that at one time and then take it to each of the schools. And then it can be a mobile exhibit traveling across the county. So that's one of the key partners working with us. And the other one is the Urbana Independent Media Center, that's going to be working with the schools and the kids over there on creating these media small videos or media kits, which can then be used as educational resources for the schools as well as others to educate them on what the kids want in schools.
Yeah, it's a myth that kids don't want to make healthy choices.
Yes.
They do want to make healthy choices. We see it all the time. We do a thing at Public Health through the dental program in the fall where we give away apples. The kids love the apples. We see what they eat during the summer food program. They want fruits and vegetables. They want them, they like them. They will pick a cutie, whether or not it has a face on it is irrelevant. They will pick a cutie over candy when that choice is available to them. The problem is, a lot of times those aren't even available, and I think a good example is, there's certain things that are just inexpensive to purchase and they get thrown out there a lot. Cake would be one of them, pizza is another one, and you can certainly make the pizza healthier, but if you can just buy a bag of apples, buy some bunches of bananas, buy some oranges that they can peel and eat, there's no preparation required, just get the stuff out there. And the kids will pick it. And we have this mentality that we have to have cupcakes, for a kid's birthday. Well, you carry in a tray of these with a little candle sticking out of the top of it. The kids are going to be just as excited as they would a cupcake. And it really is just a myth that we all think that kids want this stuff and that we're doing them a favor, but we're really not.
And what do you do to make sure that the parents buy healthy?
Well, I mean, education is one of the keys, and sometimes they don't know. And I talked last time about how with the Catch program, they learn, to shop around, let's get it started, they learn to shop around the edges of the stores. And, some of it gets down to cost. And the fact is, in this country, we have a very bizarre system, and the things that are healthy for you are more expensive. The more processed the item is, it seems like the least expensive it is. The other thing is, we don't have opportunities for people to even learn how to grow or prepare food. That was passed down to me from my parents. You just learned that. There's a whole disconnect. There's a whole generation out there who really did not get that information. And I also learned to cook and prepare food in school. A lot of that has been cut out of schools. So, we need more community opportunities because there is an entire generation who are fabulous about understanding how to cook, understanding how to garden, and we need to set up things where they can work with the younger people to teach them. The community gardens are a great example of that. Community gardens are working, toward that. And I know that there are a lot of community gardens in town too that are donating their produce to food pantries to help low-income families get healthier foods. And there is nothing to say that you have to donate. If you're going to donate to a food bank, there is nothing that says you have to donate macaroni and cheese or canned soup. That is one of those things that we tend to do. But there's you don't need to do that. If you know when that food pantry is going to be giving out food, you can go out and buy a bunch of apples. Buy some apples, buy some oranges, buy some things like that. Take it there. They will give them out the same way they would the canned soup. So there are ways, to make different choices. The other thing is, instead of donating items to food pantries, consider donating money. That will allow the food pantries that give the food out to go to the food bank and purchase healthier options to provide to to the people who come to them for assistance.
Very good.
And also, you don't have to buy fresh produce. If you grow fresh produce and it's something that's not going to last, or something that you need to get rid of before the weekend, there's a lot of resources for putting backyard growers or community garden people like we. A lot of times we'll have tomatoes that we need to get rid of before the weekend. So there's listings for when certain soup kitchens are taking food during the times.
And you can get that on our website too, and on the We Choose Health Facebook page. And so, that would be a good opportunity for people to learn on there and to share ideas.
Right. So I was going to just add a few things that, this We Choose.
Could you summarize the specific strategies
what I was
adopted to
what I was
succeed?
going to say is that we had, we got this funding a couple months back. We had a big launch last month. And we had this launch at the Carl Forum, where we had a lot of community partners pledging their support. So we know that there is, community support for this initiative.
And enthusiasm.
And this is not just a short-term project.
No.
We are committed at least through federal funding for the next 5 years. So this is going to be a long-term project, and we are hopeful that in these 5 years, we will be able to have some measurable success. At least in the 3 areas that we have selected. The coordinated school health, the smoke-free campuses, and the smoke-free multi-housing unit, as well as the employee wellness. So employee wellness we will initiate in our agency first, but we'll replicate it at other governmental agencies and small agencies and businesses for them to implement that in their own agencies.
These cups.
Oh, these are just our logo. This is this is Champaign-Urbana Public Health District's 75th anniversary year. Established in 1937. So we do want to invite everyone to come out for the 75th anniversary open house from 2 to 4 on Friday, October 9th. That is an open house to the public. 19th, October 19th.
There's plenty of parking space.
Yes, there is.
And there is public access. There's buses.
Yes, there's buses, and we will have a lot of activities planned for the public. They will get a chance to tour the building, as well as to talk to people about services we offer. They will also get a chance to participate in some of the games that the staff are putting together for people they want to be involved in, and get some prizes.
You have something out there?
Yes, this is something that we have, again, like these fitness monitors, we also have, these are called under-the-desk peddlers. Pretty inexpensive, I think $40 or $50 from Amazon.com. And you can be putting this just under your workbench, under your work desk, and be working as well as doing this. I know it's not very,
strenuous,
but it's much better than just sitting and working on your desk and sitting on the computer. This will at least give you some physical activity that you might be not getting while you're sitting for 8-10 hours a day. So this is very light activity. You don't have to think about it while you're doing it, and you are still getting some benefit out of it.
And the best part of that, I think, more than even being under the desk, is like when you're in a meeting or something, and you would think that doesn't do much, but it has adjustable tension, and I can assure you, after you do that for a little bit, you start to feel it in your legs. You will start to feel it. So it's better than just sitting, which is what most of us do. And of course, there are things you can do minor changes to, like walking meetings. I'm sure you've heard of that, rather instead of sitting around in a circle at a table, you get up and you walk and have your meetings that way, or what are some of the other strategies? There's all kinds of them. But it's just to put options out there, and at Public Health, these can be checked out.
Yes.
Because instead of going out and buying one for $50 and letting it sit there and not use it, you can try it out, and if you like it, you can have one at home and use it while you're watching TV just as easily, or doing
staff
whatever.
can buy them on their own too. You know, if they try and like them, they can buy them on their own. They're like
you have a number of them available to
we do.
To loan.
Yep, we have different like resistance bands and a lot of things like that in our wellness area, and that's just one of the things that we have. We have tread desks available, and so people can work and walk at the same time. So we are supportive of the staff that are interested in making these changes, and we're ready to make it really easy for them.
Yes.
And we have seen a significant increase in people who are taking advantage of these opportunities.
Yes.
We have, I don't know, we haven't started monitoring it yet because a lot of them started these changes before the official kickoff began, but we have people who have lost 50, 60, 70 pounds around there, and we have staff who have gotten within their BMI for the first time in their what is it called, your
Adult.
The BMI, suggested BMI, healthy BMI, for the first time in a very long time. And we have people who are walking. We have people doing yoga. Lots and lots of people who had been smokers are no longer smokers. So I mean,
and I think that's how we knew that we could implement some of these staff changes, because our staff already on their own were building opportunities to engage in physical activity.
Yes.
They started at the beginning of the year doing 2 days after work the fitness videos, and that expanded now to 2 sessions after work every single day now. So there are tons of opportunities after work and during lunch for people to do a fitness video, try yoga, try Zumba, whatever it is, and it's building a lot of relationships. It's really good for morale at the health district.
From all, we are coming to the conclusion of we choose health, and as a physician and as experienced teacher of physicians, I have seen this public health very remarkable, innovative, proactive, always looking for and doing something better. And so it's absolutely important that the Champaign County should totally make use of awesome opportunities available with Champaign-Urbana Public Health District. Now, this is not the last. This is just the beginning. We will be having a series of this informal talk and information and education from Public Health District. Next week, we would be going over as you celebrate the 75th anniversary, and after that, we would pick up the different areas of service and focus and give more details. And I certainly thank you, Julie and Nikki and Dr. Awais, for this very good time that we could share with you that right in Champaign County, there are numerous health initiatives and opportunities available that you can continuously choose health. Thank you.